Worst tornado disaster, worst tornado event, most destructive in our history. We're going to start with an update there. And then we're going to do a very important update on Omicron, which has now been detected in multiple Kentucky counties since yesterday afternoon. Let's first start with our update. My current numbers on Kentuckians lost in this tornado is now 78. I believe that the difference yesterday, we added one in Warren County. I think there is one additional in Logan County looking at the numbers I'm provided. Now, we've been talking about this the last couple days. Emergency management and the Kentucky Department for Public Health have their numbers of confirmed at 75. I hope they are right as opposed to the 78. It comes down to 3 in Hopkins County, and we at least have a path of checking up on that, which we're going to look at now, specifically looking at whether those 3 individuals have been counted in other counties, either being residents or where they might have been otherwise treated. My prayer is that I can tell you tomorrow, the next day, whenever, that my belief would be 75. But let me be clear, the number I'm operating on is 78. The number confirmed by emergency management and the Department of Public Health is 75. How about a piece of good news today? Right now, missing persons based on this tornado event are at 0. Again, those are we calculate those based on people who are reported as missing, but right now it is down to 0. Our hope is that means we won't see many, maybe any more deaths, but remember there are still a number of people in the hospital. I don't have a report on how significant injuries are, so it could grow. And then we've also had some people, at least one, lose their life in the cleanup. And to me, that's somebody who this tornado takes from us. So we will continue to update that, but I hope it's stabilizing. It's a huge, whether it's 75 or 78, that's just a huge number of Kentuckians to lose. We mourn with their families. I believe the first funeral started this week, and I believe there's at least one in the Bowling Green area today. We did increase the amount that we are providing from the Team Western Kentucky Fund for funerals. We want to make sure that we take care of these people. FEMA assistance, which is critically important right now, and I want to make sure that we put up all the different ways. Remember that so many of these counties and 6 additional counties, along with those hardest hit, have been added to individual and public assistance. The 6 new counties added are Christian, Hart, Hickman, Logan, Lyon, and Ohio counties. So those individuals impacted can start applying for FEMA help too. FEMA is on the ground in force, I think about 700 strong, more than we've ever seen before. They add to about 600 National Guard, 600 Transportation Cabinet workers, Division of Forestry, literally thousands of people in the region helping. FEMA right now is primarily in Dawson Springs and in Mayfield, I think is working towards Bremen. I was in Taylor County yesterday. They're not on the ground there, but we will be looking to provide updates. However, you don't have to wait until they're on the ground, walking house to house, or have set up a center. There are 3 ways for everybody to start making their claim. Number 1, online, disasterassistance.gov. Even if it just starts the process, it's important. Number 2, you can download the FEMA app. And number 3, you can call 1-800-621-FEMA. That's 1-800-621-3362. Do we have the locations that they have set up, their centers in Mayfield and Dawson? Look for that. We can come back to that later. So in the areas that they are hardest hit, you can do these 3. You can talk to someone who is walking door to door, or what used to be doors to doors, destructed home to to a home that's gone. Or you can go to their intake centers in again, at least the 3 hardest hit counties. There are intake centers where you can come in and get that process started. Power numbers, I get about 3 different numbers of people that are without power. Listen, Mayfield, the meters are down, so none of our numbers include Mayfield. That's the most significant area out of power. And on top of that, there are at least 3,866 homes, businesses that are without power. About 250 homes in Warren County are without power. Drinking water in Paducah, there is about 11,000 people on a boiled water advisory. The Mayfield boiled water advisory was lifted as of 11 a.m. yesterday. That's pretty good news. Customers in Hardeman and Hickory that are operated by Graves County continue to be on boiled water advisory. I think our point here is people are working really hard to get that power back on and to get water not only restored, but in a good place. Paducah wastewater region, Benton wastewater treatment plant, limited operation. Mayfield wastewater treatment plant, limited operation. So again, that's more on the sewer side, but it is in progress. Dawson Springs, limited operation, but power has been restored to the plant. 1 of 5 lift stations are on a generator. Little over 550 National Guard right now, supply, distribution, traffic control, and law enforcement, because we've got people out there who would steal things from people at their lowest moment, things that are probably already ruined. And we are going to do everything we can to prevent that from happening. As of this morning, our state parks are providing housing and food services for 636 displaced Kentuckians and 188 first responders. Kentucky Dam Village is full, 136 displaced Kentuckians, 169 first responders. Kinlake, though, has 13 rooms available, and we have folks that are in shelters in the region. So please, if you're at a shelter, and we can move, if 13 rooms would cover everybody, let's get them to a place where they can spread out, especially with the Omicron report we're going to have, and we can take care of them. Kinlake has 146 displaced Kentuckians, 6 first responders. Lake Barkley has 2 rooms available. They currently have 201 displaced Kentuckians, 13 first responders. Barren River Lake State Resort Park has 20 rooms available. I know if you're in the hardest hit area, it's about an hour and a half away, but we can take care of you and your family. Those rooms are available. John James Audubon, 2 rooms. Pennyroyal is totally full. That's where I went to my grandparents' 60th anniversary. I think that was the last time I saw my granddad a couple decades ago. It's got 125 displaced Kentuckians. In Rough River Dam State Resort Park, 21 rooms available. The Red Cross is currently at Barkley, Pennyroyal, Kinlake, and Kentucky Dam Village, providing services, counseling, and help. That's really good coordination, and we appreciate it. And then for at least 4 of our parks, Kentucky Dam Village, Kinlake, Barkley, and Pennyroyal, we have enough volunteers through Christmas Eve, but we do need volunteers from Christmas Day through that next week. So again, get in contact if you are willing to volunteer Christmas Day through that next week. They will need some help. Between parks and hotels, we believe that we are housing 944 Kentuckians. That is approximate. And remember, we open our homes to those that have lost theirs. So many more staying with kin and or friends. All right, update on unemployment assistance. Obviously, traditional unemployment system assistance is available, but we have now been qualified for disaster unemployment assistance. And that kicks in for a lot of people who would not typically qualify for unemployment assistance. Individuals who became unemployed or who are self-employed and have had work interrupted in 14 Kentucky counties as a direct result of these tornadoes on December 10th, 2021 are eligible to apply for disaster unemployment assistance through the Kentucky Office of Unemployment Assistance. The counties that have been approved, they call this DUA, are Caldwell, Christian, Fulton, Graves, Hart, Hickman, Hopkins, Logan, Lyon, Marshall, Muhlenberg, Ohio, Taylor, and Warren. In order to qualify for the benefits, you must show that your employment or your self-employment was lost or interrupted as a result of this disaster, and that you're not otherwise eligible for traditional UI benefits. So, for instance, farmers and other self-employed individuals who are traditionally ineligible for unemployment insurance may qualify for this program. Individuals will need their Social Security number, a copy of their most recent federal income tax forms, or check stubs. And if all that's gone, we'll work with you. We'll work with you to find it. To receive these benefits, all required documentation must be submitted within 21 days from the day the application is filed. But again, we'll work with you on trying to find that documentation. You know, what this reads like, and I get it, is this is the program. The program wasn't set up for somebody that doesn't have even a driver's license. So I know what I was given today, but we'll work with you on whatever we need to. Affected individuals should visit the Kentucky Career Center website or call 500-875-0442 to file their initial claim. The deadline to apply for assistance is January 18th, 2022. All right, so if you might qualify for disaster unemployment assistance, the first thing you got to do is apply for traditional unemployment assistance. And you may say, well, I'm a farmer and I'm never going to qualify for that. That's okay. You got to apply and be denied to get the disaster unemployment assistance. Might not be efficient, but it is what you got to do. So first, go online or go to the number and make the application for the traditional UI benefits. And then attend an in-person session at one of the following locations anytime through Wednesday, December 21st through December 22nd, 8 a.m. to 5 p.m. We've got a listing up here. We have them in Bowling Green, Madisonville, E-Town, Owensboro, and Mayfield. Additional days and times we'll make available December 27th through the 29th at locations that we will get out there. Updated information will be communicated at kcc.ky.gov, but I'm going to give you that information too when we do updates. When filing a claim in person, which is what we're going to try to help with, self-employed individuals should bring a copy of their 2020 income tax return. You'll also need photo ID, which we can help you at the stations we are setting up through the transportation cabinet. We'll make sure to get all of that together too. You also need a bill showing your physical address. We'll work with you on finding that as well. And current mailing address confirmation if changed. Good news here. Federal government has approved disaster unemployment assistance, and that's going to help some people who don't typically qualify. As I read it, the kind of tough news, the process doesn't seem to be created for folks that have lost everything. My pledge is we'll do the best we can to work through the complicated system that appears to exist. More good news. Team Kentucky Fund, now 105,370 donations, $19,777,726. As I mentioned, the first expense that we approved were funeral expenses, and we have increased the amount that we're providing to families to $10,000. They shouldn't have to have a cheap funeral for their loved one. That's not right. No one's had to apply. We get the information directly from Vital Statistics and are reaching out to the families, and those dollars are already going out. All right, next step in that Team Western Kentucky Relief Fund. Our plan is to specifically provide extra help to uninsured homeowners that lost everything. So if you know Dawson Springs like I do, many of the people in the area that was hit were those that are struggling the most. Those that didn't have homeowners insurance because Either they couldn't afford it or they didn't think it was worth it based on what they had. Those people have lost absolutely everything. And as time moves forward, we want to help others too. But this is a specific need of people to get back on their feet. And it's one the president mentioned specifically to me. So we are putting together a program, and we're still in the planning stage, to provide 10% in additional funds above and beyond what FEMA awards for expenses over and above what FEMA covers by category. What this means is the money cannot be used for the same expenses that FEMA is reimbursing. But we're going to work with FEMA to say who has applied, who is uninsured, what were they awarded, and let us do 10% on top of that. My challenge to other funds out there that are looking for how they can help is do more on top of what we're doing. So the maximum that you can get to rebuild that home from FEMA is $37,900 if you qualify for all of it. This will get people who qualify for that full amount over $41,000. If we can, folks out there across the country or Kentucky, let's do a little bit better. Let's try to make sure that we help these people out at a level at which we've never seen in response to a disaster. But I know that this is the next biggest need, and that's where we're headed. Our guess is there between 1,000 and 2,000 families that are uninsured in their home, and we're going to help them out. All right. If this wasn't enough, right? We have Omicron, however people want to say it. It's now been confirmed in Kentucky and reported by Kentucky Department of Public Health, first reported by Gravity Diagnostics, an incredible partner in all this, on Friday, December 17th. Positive samples were found from patients living in Kenton, Campbell, and Fayette counties. And as of this morning, it's been detected in Jefferson County by wastewater testing performed by the University of Louisville and the Louisville Metro Health Department. I'm going to turn it over to Dr. Stack for further comments, but let me say that this is one of the most transmissible viruses, this variant, in modern human history. We hope that the sickness that it causes is milder, and there's some indications of that. But this thing is going to spread so fast that any school that is not doing mandatory masking, any business that is not having their folks wear masks, could see entire schools, entire shifts get infected very, very quickly. We have found a way to live with COVID-19, even while so many people are dying. We found a way to go back to work and to stay in school. But folks, I'm telling you that if we don't make the decision to put back on that mask in these situations, it's going to disrupt everything we have worked so hard to get back up and going. So if you are an individual out there like me that wants our economy to continue humming, wants your kids to be in school, time to make the right decision for humanity, for your kids, and be willing to support the masking that's required. Dr. Stack.
Thank you, Governor. Good afternoon, Kentucky. Just a quick word on the tornado disaster. My thoughts and prayers with all the people in those communities. I had the opportunity to go down there on Wednesday with some of the leadership from the Department for Public Health and meet with public health leaders in some of the most affected counties. Again, our hearts go out to you. We're here for you. And I'm grateful to the governor, Director Dossett, and all the many other response agencies doing such great work. So we're here with you, and we will continue to support you as we work to help you recover and get through this. So back to what the governor said about Omicron. The Omicron variant of COVID-19 is probably one of the most transmissible or contagious infections we've had in the last century, at least. To put this in perspective, one person who gets influenza may infect 1 to 2 other people. The Delta variant really escalated COVID's transmissibility, and one person with the Delta variant may infect up to 5 other people under the right situations. Omicron now, it may be that one person with Omicron could infect up to 18 to 20 additional people. So, this is not the progression we want. The virus continues to get more effective in certain ways. And so it's more important than ever that we take the benefit of the things we have learned over the last nearly 2 years so that we can take relatively focal steps to minimize its spread, to minimize the harm it causes, and still be able to go on with our lives. This virus also, Omicron, because it is so transmissible, doubles in a community incredibly quickly. So we were telling you as recently as this past week that virtually everything in Kentucky was Delta virus, or the Delta variant. Now that we found it here, and we found it in three of the three big metropolitan areas, it will spread incredibly rapidly. So we can effectively go from 0, and if you start doubling things, 0 to 1.5 to 3 to 6 to 12, we could go from Omicron not being present at all to Omicron being half or more of all the variants of COVID in the state in the span of just a couple weeks. And in fact, over the span of about a month, it could outcompete everything else. And just like Delta wiped out the other competitors for the variants in about 2 months, this one could do the same thing in a month or less. So folks, it is clearly a different chapter in this journey. The good news, should there be good news with this, is that so far in the countries most impacted by this, so South Africa and United Kingdom, while the numbers have spiked dramatically, the hospitalizations have not yet shown the same kind of spike you would have seen. Now, that doesn't mean it's not dangerous and important. It doesn't mean that they haven't had increases in hospitalizations, but the proportionality appears to be less, and that's really, really important. Now, in the United Kingdom, they have a very highly vaccinated population, particularly in the elderly population. And South Africa has a younger population. So there's a lot of complexity when you interpret these, but we're going to have to hope that it is less severe and that hopefully that helps to give us a little bit of a reprieve from the harm that it might otherwise cause. So on vaccines, so mRNA vaccines, Pfizer and Moderna, are still effective against Omicron. Now, you need to have that booster dose. It makes a huge difference. If you get a booster dose, we feel very confident that Pfizer and Moderna vaccines are going to provide very good protection against severe disease and death from COVID-19. That's the good news. The disappointing news is that Omicron is so effective at infecting people that the breakthrough cases are going to go up. And so the number of people who are even fully vaccinated and boosted who could have mild disease, so think about having cold symptoms, will go up almost certainly. But remember, the vaccines, if they keep you from ending up in the hospital and they keep you from dying, they have done their job. That is the most important stuff we ask of them. And the evidence now is a fully boosted person with an mRNA vaccine is still very well protected. In Kentucky, 17% of the state is fully vaccinated and boosted. We need more people to go out and get boosted, please. It's widely available at the pharmacies. It's available at more doctors' offices than before. Federally qualified healthcare centers, rural health centers, please go out and get your booster. That's anyone 16 and older who is more than 6 months out from your second dose of an mRNA vaccine. Please get boosted. 62% of all Kentuckians today we believe to be fully vaccinated. We need everybody in that population to go get vaccinated and or for the first time and or get boosted. In some counties, the proportion of people vaccinated is less than 1 in 3. Folks, that's a recipe for disaster, particularly with something like Omicron, because if it sweeps through your community, it'll hit everybody, hit quickly, and that's a recipe for disaster. So please, we're just trying to help you and help keep you safe. I hope you'll be open to going and getting vaccinated. It's widely available. Data is showing your prior infection with COVID is unlikely to be sufficient to protect you from reinfection. So even if you have had COVID, if you get vaccinated with an mRNA vaccine, that will really protect you far, far better. We'd urge you to do that. A word on the Johnson & Johnson vaccine. The CDC issued new guidance just in the last few days. mRNA vaccines are now clearly preferred over J&J. So it is going to be a very clear preference, and I would suspect everybody who goes out and gets newly vaccinated now probably should just go get Pfizer or Moderna. And if you have previously had J&J and not yet been boosted, 2 months after your J&J dose, you should go out and get any one of the mRNA vaccines, Pfizer or Moderna, and get boosted. The pharmacies and others will allow you to pick whichever of the two you prefer. A word on monoclonal antibodies. These have been very helpful for people to minimize the risk of progressing to severe disease and death. They've been very effective against the Delta variant. Bad news is 2 out of the 3 of those monoclonals do not appear to be effective against the Omicron variant. And the worst news is that those 2 that are not effective against Omicron are the ones we have the most of. So you cannot wait to get sick and then hope that the monoclonals will rescue you. Now more than ever, I would say vaccination is so important because that will work against all of these variants to help minimize the risk of severe disease. We've got a wonderfully robust monoclonal distribution system set up now in the state, but if we don't have effective monoclonals, they won't have anything to offer you. So folks, please go get vaccinated. You can't count on the monoclonals. Now, if they design new ones and they're effective, of course, we'll be ready to distribute those immediately, and our sites across the state are ready to administer them. The Merck and the Pfizer pills, again, every little bit helps, but I want to offer a little caution on this. The Merck pill, unfortunately, the more final data showed it was only about 30% effective, preventing the progression from mild to moderate disease to severe. It must be started within 5 days of symptom onset. You must have a positive test to confirm your infection before you can be given it. You cannot be pregnant or trying to get pregnant or possibly going to get pregnant in about the week after you have the medication. So there are some restrictions. And the supply will be extremely limited. So folks, it will be very, very difficult to get this for many months to come until they escalate production. So even though we will make it available as soon as we have it, and we don't have it yet because an authorization has not yet been issued, you cannot rely confidently that you'll be able to have access to it. That's just a supply situation and nothing else. The Pfizer pill, the data looks better. It could be up to 89% effective, but you have to give it within 3 days of your symptoms starting. So the window is very short. And again, the amount of supply that will be available both won't come to us until mid-January or later probably. And if it's approved, and it hasn't gone through that yet, and the supplies will be exceedingly small. So again, over time, hopefully these therapies will be helpful and enable more people to be treated effectively if they get infected. But you cannot rely on that during this Omicron surge. It's going to take more time. And on testing, we are distributing Binax Now cards to local health departments and a number of other settings for rapid antigen testing, and also Illume, which is another at-home test. We're using these in the tornado-affected areas to distribute them, so they have them at shelters and at local health departments and other settings. They do work for finding Omicron. That's the guidance the FDA has given, so you can use those with confidence. And now I'm going to wrap up and say, as we look to the holiday season, and obviously as we look at the impacted areas in Western Kentucky from the tornado, you know, they're the holidays. We have to still find ways to enjoy each other's company and celebrate the holidays. There are things you can do. If you are sick, if you are sick, you have a fever, a cough, a runny nose, a sore throat, stay home, please. Do not go to school. Do not go to work. Do not go to a party. If you are sick, the easiest thing we can do is not knowingly spread infection, no matter what type of infection it is. The second is please get vaccinated for COVID. And also, please get vaccinated for influenza. The strain this year is the H3N2 strain. It's associated with a little bit worse disease, but the current vaccine this year does contain that strain. So this year's vaccine should be very helpful. Please get vaccinated for COVID and get vaccinated for influenza. Third, when you're indoors around other people, certainly in public spaces, and definitely when you're close to people, please wear a mask. If you're going to be in an indoor space for an extended period of time, upgrade your mask. For those of you who are attentive, and I know there are people out there because I get comments, I have an N95 now. So I've upgraded my mask when I'm going to be in an indoor space for an extended period of time. This virus is much more contagious, the Omicron. So if you can upgrade your mask in those situations, I recommend you do that. If you're gathering with family or friends for the holidays, and yes, I'm not naive, I know you're going to do that. If you do that, if you can find them, go to a Walgreens or a Kroger or a Walmart or any other chain pharmacy and buy in-home tests, the antigen tests, If everybody can test themselves before they go into the party and everybody's negative, that is going to lower your risk tremendously. And that is what the future in 2020 looks like. The federal government's going to distribute more than 300 million tests, hopefully over the next 3 to 6 months, and dramatically escalate the production of those and make them more available to empower all of you and all of us to take the responsible steps to test ourselves before we go into these situations, remove ourselves from them if we are infected, and still be able to have some confidence we can get together, share time and enjoyment with each other while not spreading COVID. And if you do test positive, please don't go out of your house. Stay there for 10 days after the positive test or your symptom onset, whichever was first, and only leave if you need to go get medical care. Otherwise, stay home just so we don't spread this. And the very final thing is, if you are 60 or older, or if you have any major medical problems, even if you're vaccinated, you should really be very thoughtful and consider, do you go into situations where you're around a lot of other people who may not be vaccinated or even who are vaccinated? Because even though they will be protected, hopefully, from severe disease, they could still infect you. And we know that this is a very age-dependent disease. So if you're over 60, the risk is much higher. So please take those steps. And I want to just emphasize what the governor said. School settings and places of employment, none of us want to go back to this, believe me. Your health professionals are as exhausted as you are. But this does work. It does lower the risk. Is it perfect? No, we've never said it was perfect. Is it incredibly helpful? And is there now a mountain of evidence that shows these reduce the spread? Absolutely. So I would urge you, protect yourself if you're vulnerable. And if you're in settings where there are vulnerable people, I would ask you to exercise some kindness and care and try to protect them as well by wearing your mask. Thank you very much, Governor.
So I think the message to everybody is, first, we care about you, right? And that's why we're trying to get what we believe are the science and the facts to you. About 75% of all Kentuckians over the age of 18 that can make their own healthcare decisions have gotten vaccinated. Good for you, and we appreciate that. But in looking at this, to those that are unvaccinated, just consider now possibly to be the time. With as contagious as this is going to be, you're going to get the Omicron variant. And if it makes you really sick, some of our therapeutics won't work. You know, we've seen folks before that, you know, won't take the vaccine, but are willing to do the monoclonal antibodies. Some of that is not going to work on this one. We hope anything you get would be milder. If it is more severe, just the options in treating you, at least until some other things come online, are going to be less. And if you are vaccinated, it alone isn't enough to keep you from getting this. And ultimately, we hope it would just be disrupting your life for that period of time. So again, best things we can do, get vaccinated, wear a mask in the appropriate settings. So with that, we will open it up to questions. We'll start with Evelyn Schultz.
Hi, Governor. Only 1 in 6 Americans has gotten a booster so far. Are there specific outreach efforts you all are planning to encourage people who are fully vaccinated to also go ahead and get that booster shot?
Well, we're willing to consider anything that'll get the word out. We have done better on booster shots for those that are fully vaccinated than just about any of our surrounding states. We continue to get, sometime over the weekends, 45,000 individuals boosted. It's a little hard to tell what's possible because you can only get it 6 months after that second shot. I'm generally pleased that people are getting their boosters, but they need to get it faster. Sometimes things like this, right when Delta hit, increases the urgency. So one thing we can do is level with people about what we're facing. You get your booster. What we've seen generally is this may be like getting a cold, maybe a little worse. You're going to be all right. But the reason to put on that mask is you're not going to be able to go out for 10 days without potentially harming other people. Tom Laytek.
Okay, thanks, Governor. I guess this is more of a Dr. Stack question, but how long ahead of these gatherings, you talk about going to the store and picking up the home testing kits. How much time is there needed between the time you take it, and you get the
Yeah,
results
so-
back so that, you know
Well,
how. in advance.
I can field that. You want to take the test as close to the gathering as humanly possible. If you can get the test and take it the morning before you are about to leave, that is the best time. I went to a groundbreaking where everyone was tested before they walked into the tent, right outside. And there is a future where we're going to be able to do that, which is really incredible because we didn't have a test. We in March of 2020, and then the test, one we've all taken a bunch of times, was both intrusive and took time to get back. Remember when it would take a week or even more to know, and now you can get it. Take it that morning. Take it before you get in the car, and be so much safer.
So it's almost instantaneous.
Yes, you need to take it as close as you can before going into that other person's home or at the gathering. Debbie.
You don't know how many individuals in Kentucky have tested positive for the Omicron, and how quickly you will see it spreading.
So thus far from other regions, it suggests it doubles every 2 to 3 days. So that's the most rapid rate of doubling that we have seen. Individuals, yeah, right. We'll work on that number. What it'll be is we'll know how many sequencing that we did came back to show it. We'll get that number, but it's not 4 individuals right now. You know, this is already a certain percentage of cases that are out there. We just saw it for the first time yesterday. Karen Czar.
Good afternoon, Governor, and hello, Rachel. One for you and one for Dr. Stack. For you, how is the rain hampering efforts in Western Kentucky this weekend? And then for Dr. Stack, if you got the J&J and the J&J booster, should you consider getting the Moderna or Pfizer as a third shot? And if so, how long do you need to wait? Thank you.
The rain that's hit Western Kentucky the last day and a half is mean. It's just mean. I mean, it's really hard to understand how they could get hit with a hurricane, a tornado, the likes of which we have never seen. And then it dumps rain on them as they're trying to dig out. It slows down some things, not all things. Certainly services that we're providing people, it can hamper. And whether that's them trying to cover up their stuff with the tarp instead of going and getting a new driver's license, it's not helpful. But the people are pushing through. And I just mentioned again, we are in pain and we are knocked down, but we are not broken. And I think we have seen through this that we don't break, whether it's this or the COVID pandemic. We're going to dig out. We're still digging out. We're going to clean up, and that started in some places. And then we're going to rebuild both structures and lives. Doctors. Okay, so 6 months after the second J&J shot, go get a Moderna or go get a Pfizer. Don't get a third J&J. And if you've only had the one J&J, go out and get Moderna or Pfizer, more important now than ever, and then talk to the people that are getting it about a booster after that. Melissa Patrick.
Hi, Governor. So as you've said, and other experts are saying that vaccine and boosters are not going to be enough to stop this Omicron. You know, we have to do the masking and the social distancing and the quarantine and all that. But obviously, you know, you don't have authority to require that right now. So what does that mean for Kentucky in the coming months as we again rely on people to think and act for the collective good to stop this virus?
Yeah, this is a moment where stripping authority from a governor may come back to bite us. But what I can do is give people the facts, just the straight facts about how quickly that this is going to spread. Certainly, we are blessed with the vaccines in that it appears to prevent severe, serious illness and death from, as long as you're boosted, you don't have waning immunity from Omicron. But listen, just getting COVID is a significant disruption to your life and to our economy. So We just need people to make the smart decision for them, for their businesses, for their schools, and for the people around them. I mean, if you've got one of the most contagious viruses that we've known, that's what we think this will be in modern history. If you're not making the right decisions, you're absolutely infecting people around you. Listen, we've seen an outpouring of love and support this last week. Let's just continue to be good people and to protect one another. Kate Howard.
Hi, thanks, Governor. Two questions. In regard to the unemployment disaster assistance that's available, what does the backlog for unemployment look like now, and how long can these folks expect to wait to get approval for that? And then in regards to Omicron, obviously, folks in Western Kentucky who are dealing with the tornadoes, there's a tremendous need at the hospitals. How prepared are they? What resources might be available to help them battle Omicron in addition to the tornadoes in Western Kentucky?
All right, we're working directly with the hardest hit hospitals. Certainly Mayfield was running off tanker trucks of water. Water is the most important thing there. They can run on generators, but getting that flow of sanitary water to them is what is needed the most. What we're going to need to do with all hospitals as we move forward is preparation, and part of that's preparation what we went through as Delta. And we still don't know how many people will be hospitalized, how much severe illness there will be. That's the number we don't know. So what we know is the number of infected is going to be much higher, much higher than what we've seen. Our case numbers might not even tell us that much moving forward, other than how quickly it is spreading. Hospitalization is going to be much more telling as we move forward. You know, if it infects 10 times more people, but only causes half the severe severe illnesses, we're still in a worse place. But again, if it infects 5 times more people, but only causes 10%, then the steps we have taken in the past that we can turn on may be sufficient. So a whole lot we don't know there. Obviously, we are hoping that the hospitalizations will not be as high as what we have seen. Did I miss a second question? Okay. The backlog for unemployment should not be an issue with helping these people. We're being able to set this up with lessons learned. We're going to work very closely and in person to make sure that we can both process the unemployment claims for these folks that will have to be denied to get this next process. But again, we're setting up direct help on multiple days to walk people through it in person. Michael Shore, News Nation. Okay, that is our report for today. We will let you know next time we're likely to get together is Monday for that 4 p.m. Report. I know that we're going to be out there a lot this week, especially with the kids in the infected, with the kids in the impacted region from these tornadoes, making sure they have a really great Christmas. To everybody out there, thanks for your love. It's a whole country of support that's flowing in, sometimes so much we don't even know what to do with it. But Kentucky feels that. We love you too, and we appreciate it. Thank you.